Feeling like things just aren't quite working in the bedroom like they used to? You're certainly not alone in that. It's a frustration many men face, and it can feel like a quiet, personal struggle, something you might not even want to bring up with your doctor. You start questioning yourself, your health, maybe even your relationship. It can chip away at your confidence, leaving you feeling less like yourself. It's a painful reality for a lot of men as they get a little older, this unexpected challenge with erections. You might think it's just a natural part of aging, and while age can play a role, there's often more to the story. Sometimes, the very things we're doing to stay healthy in other areas might be quietly working against us here. What if I told you that some very common medications, the ones you might take every day for important health conditions, could actually be killing your erection without you even realizing it? It's not talked about enough, this potential side effect of drugs that are otherwise beneficial. But it's a secret you need to know about, because understanding it is the first step towards finding a solution and feeling confident again. In this video, we're going to explore 5 common types of medications that are often culprits when it comes to erectile dysfunction. We'll look at why they might cause issues and, crucially, what you can do about it, always in partnership with your doctor. Please, make sure you watch all the way to the end, because we'll reveal something that might genuinely surprise you about how you can approach this challenge. Let's start by looking at the first type of medication that frequently comes up in conversations about erectile difficulties, those prescribed for high blood pressure. Now, high blood pressure is incredibly common, especially as we get older, and taking medication to control it is vital for preventing strokes, heart attacks, and kidney problems. These medications are lifesavers, truly. But some of the most commonly prescribed ones, particularly certain types of diuretics, often called water pills, and certain types of beta blockers, can unfortunately have a significant impact on erectile function. Think about it. An erection is all about blood flow. It requires healthy blood vessels to relax and allow a rush of blood into the penis. High blood pressure medications work by altering how your blood vessels behave or by affecting how your heart pumps. While this is great for reducing strain on your cardiovascular system, sometimes these actions can interfere with the delicate process needed for an erection. Let's delve a little deeper into beta blockers. These are often prescribed not just for high blood pressure, but also for heart conditions like angina, irregular heart rhythms, or even anxiety and migraines. They work by blocking the effects of adrenaline on your heart and blood vessels, slowing the heart rate and reducing blood pressure. While this is beneficial for many conditions, adrenaline also plays a role in the nervous system responses that contribute to sexual arousal and function. By dampening the effects of adrenaline throughout the body, beta blockers can sometimes reduce libido or make it harder to achieve and maintain an erection. It's like turning down the volume on the body's fight or flight system, which unfortunately can also turn down the volume on sexual response for some men. Different beta blockers affect men differently. Some of the older, less selective beta blockers are more notorious for causing erectile issues than newer, more selective ones. If you're taking a beta blocker and experiencing problems, it's not a sign you should stop taking it. Absolutely not. It's a signal to have a conversation with your doctor. They might be able to switch you to a different beta blocker that's less likely to cause this side effect, or perhaps explore a completely different class of blood pressure medication altogether. Then there are diuretics, the water pills. These work by helping your body get rid of excess salt and water, which reduces the volume of blood flowing through your vessels, thus lowering blood pressure. While effective, some diuretics, especially thiazide diuretics like hydrochlorothiazide, have been linked to erectile dysfunction. The exact mechanism isn't fully understood, but it's thought that they might affect blood flow or possibly even zinc levels in the body, which can play a role in sexual health. They can also sometimes reduce the amount of fluid in the body to the point where blood flow to peripheral areas, including the penis, might be compromised. Again, these are essential medications for many people, preventing serious complications of high blood pressure. You shouldn't just stop taking them. The conversation with your doctor might involve trying a different type of diuretic, or combining a diuretic with another type of blood pressure medication that has a lower risk of sexual side effects. Sometimes, the issue isn't even the type of medication, but the dose. Your doctor might be able to adjust the dosage or timing of the medication, which could help alleviate the problem without compromising the control of your blood pressure. It's really important to remember that managing high blood pressure is crucial for your overall health and longevity. Any decision about changing medication must be made in close consultation with the doctor who prescribed it. They understand your full medical history, all the conditions you have, and all the medications you take. Stopping blood pressure medication abruptly can be very dangerous, leading to a sudden spike in blood pressure that could result in a stroke or heart attack. The goal here is awareness and empowered discussion, not self-treatment. Knowing that your blood pressure medication could be contributing to erectile difficulties gives you a starting point for that conversation with your doctor. You can go in and say, "Doctor, I've been having some trouble with erections, and I understand that my blood pressure medication might be a contributing factor. Are there any alternatives or adjustments we could consider?" This opens the door for your doctor to review your options, perhaps suggesting a different medication or combination of medications that control your blood pressure effectively, while having a less negative impact on your sexual function. There are many classes of blood pressure medications available, and not all of them carry the same risk of erectile dysfunction. For example, ACE inhibitors and angiotensin II receptor blockers, ARBs, are generally considered to have a lower risk of causing ED compared to some beta blockers and diuretics, and in some cases, they might even improve erectile function slightly. Calcium channel blockers are another common class, and their effect on ED is generally considered neutral or minimal compared to beta blockers and diuretics. So there are absolutely options to explore with your doctor. It's a matter of finding the right balance for your individual health needs and quality of life. Now that we've discussed how blood pressure medications, particularly certain beta blockers and diuretics, can impact things, let's move on to another very common group of medications that can sometimes be the culprit: those used to lower cholesterol. Cholesterol-lowering drugs, especially statins, are widely prescribed to reduce the risk of heart disease and stroke, and they are incredibly effective at what they do. They work primarily by blocking an enzyme in the liver that's needed to make cholesterol. Lowering cholesterol levels is vital for keeping your arteries clear and blood flowing smoothly throughout your body. However, just like with blood pressure medications, sometimes the way these drugs work can have unintended consequences. For a while, there was some debate about the link between statins and ED. Some studies seemed to suggest a negative link, while others were inconclusive or even suggested a potential positive effect in some men by improving overall vascular health. The current understanding is a bit nuanced. While improving overall cardiovascular health should, in theory, improve erectile function by promoting better blood flow, statins work by reducing cholesterol production, and cholesterol is a building block for many hormones in the body, including testosterone. While the effect on testosterone levels is usually small and often not clinically significant enough to cause ED directly, some men might be more sensitive to these changes. Furthermore, the impact of statins might not be solely about hormones. Erectile function relies on healthy endothelial function, the ability of the inner lining of your blood vessels to relax and expand, allowing blood to flow in. While statins are generally good for endothelial health long-term, There's still ongoing research into exactly how they interact with the complex pathways involved in achieving an erection. Some men might experience muscle aches or fatigue as a side effect of statins, and these general feelings of unwellness can also dampen libido and make sexual activity less appealing or more difficult. So, if you're taking a statin and noticing issues with erections, what should you do? The first and most important step, as always, is to talk to your doctor. Don't stop your statin medication. Lowering your cholesterol is crucial for preventing potentially life-threatening cardiovascular events. Your doctor can review your medication and your overall cardiovascular risk. They might consider trying a different type of statin, as some individuals react differently to different formulations. Sometimes, lowering the dose of the statin, if appropriate for your cholesterol levels, might alleviate the side effect. Or they might explore non-statin options for cholesterol management, although statins are usually the first-line treatment due to their proven effectiveness. Another class of medications that can impact sexual function, and this might be one of the surprising ones I hinted at, are those used to treat depression and anxiety. Antidepressants, particularly a widely used class called selective serotonin reuptake inhibitors, or SSRIs, are notorious for causing sexual side effects in both men and women. SSRIs work by increasing the levels of serotonin in the brain, which helps improve mood. However, serotonin is a neurotransmitter that also plays a role in regulating sexual desire, arousal, and function. By altering serotonin levels, these medications can dampen libido, make it difficult to achieve an erection, delay or prevent ejaculation, which is often the most common sexual side effect reported by men on SSRIs, or make it harder to reach orgasm. The prevalence and severity of these sexual side effects vary widely, depending on the specific SSRI, the dose, and the individual person. Some people experience very minimal or no sexual side effects, while for others, they can be quite bothersome and impact their quality of life. It's a difficult situation because these medications are often vital for managing conditions like depression or anxiety, which themselves can also negatively impact sexual desire and function. So, it can be hard to disentangle the effects of the medication from the effects of the underlying condition. If you're on an antidepressant and experiencing sexual side effects, it's incredibly important to discuss this with the doctor who prescribed the medication. Do not stop taking your antidepressant on your own. Stopping these medications abruptly can lead to withdrawal symptoms and a return or worsening of your depression or anxiety. Your doctor can explore several options with you. They might be able to switch you to a different antidepressant that is less likely to cause sexual side effects. For example, some antidepressants, like bupropion, a different class called an NDRI, are less likely to cause sexual dysfunction and are sometimes even used specifically to counteract the sexual side effects of SSRIs when used in combination. Your doctor might also consider adjusting the dose of your current medication. Sometimes, taking the medication at a different time of day can help, though this is less common for sexual side effects than for others like nausea. In some cases, if the sexual side effects are particularly problematic and switching medications isn't ideal, your doctor might even consider prescribing a medication specifically for erectile dysfunction, like Viagra or Cialis, to be taken alongside your antidepressant. The key message here is that you have options, but they require open communication with your prescribing doctor. They can help you weigh the benefits of your current medication for your mental health against the impact on your sexual health and help you find the best path forward. Addressing mental health is crucial, and you shouldn't have to suffer silently with side effects that can potentially be managed or mitigated. Moving on, let's consider another common category: medications for an enlarged prostate, also known as benign prostatic hyperplasia, or BPH. BPH is extremely common in older men, causing bothersome urinary symptoms like frequent urination, difficulty starting or stopping the stream, or feeling like you can't empty your bladder completely. There are several types of medications used to treat BPH, and some of them can affect sexual function. Two common classes are alpha blockers and 5-alpha reductase inhibitors. Alpha blockers like tamsulosin or alfuzosin work by relaxing the muscles in the prostate and the neck of the bladder, making it easier to urinate. While generally well tolerated, they can sometimes cause retrograde ejaculation, where semen goes backward into the bladder instead of out through the penis. This isn't harmful, but it can affect sexual satisfaction and fertility, though fertility is less of a concern for the audience we're speaking to. They can also sometimes cause a decrease in the amount of semen ejaculated. Alpha blockers are generally less likely to cause erectile dysfunction compared to some other medications, but it is still a reported side effect for some men. 5-alpha reductase inhibitors, such as finasteride and dutasteride, work differently. They shrink the prostate gland by blocking the conversion of testosterone to dihydrotestosterone, DHT, a hormone that contributes to prostate growth. By lowering DHT levels, these medications can effectively reduce prostate size and improve urinary symptoms over time. However, because they affect hormone levels, they can also affect sexual function. Decreased libido, sex drive, is a known side effect of these medications, and they can also sometimes cause erectile dysfunction and a decrease in the volume of ejaculate. These side effects are often dose-dependent and can persist for some men even after stopping the medication, though this is less common. If you are taking medication for an enlarged prostate and are experiencing changes in your sexual function, it is definitely something to discuss with your urologist or the doctor managing your BPH. They can assess your symptoms and discuss the trade-offs. For example, if your urinary symptoms are mild, they might suggest trying lifestyle changes instead of medication. If medication is necessary, they might explore switching to a different class of BPH medication. Some men find that alpha blockers have fewer sexual side effects for them compared to 5-alpha reductase inhibitors, or vice versa. It truly varies from person to person. Your doctor can also discuss whether the benefits of the medication for your prostate symptoms outweigh the sexual side effects, and whether adding an ED medication might be an option to help manage the erectile difficulties. Again, the key is open and honest communication with your healthcare provider about all your symptoms, including sexual ones, as they are an important part of your overall well-being. Finally, let's touch upon a class of medications often used for pain relief and inflammation, particularly corticosteroids. While not as commonly linked to chronic ED as some of the other classes we've discussed, long-term or high-dose use of corticosteroids like prednisone can potentially impact sexual function. Corticosteroids are powerful anti-inflammatory drugs used for a wide range of conditions, from asthma and allergies to autoimmune diseases like rheumatoid arthritis or inflammatory bowel disease. They work by mimicking the effects of hormones produced by your adrenal glands. However, long-term use of these medications can suppress your body's own production of these crucial hormones, including sex hormones like testosterone, which are also produced in smaller amounts by the adrenal glands. Low testosterone levels can definitely contribute to decreased libido and erectile dysfunction. Additionally, long-term corticosteroid use can lead to other health problems like weight gain, high blood pressure, and diabetes, all of which are independent risk factors for erectile dysfunction. So if you are on long-term corticosteroid therapy and experiencing issues with erections or sex drive, it's a valid concern to bring up with the doctor managing your condition. Like the other medications we've discussed, corticosteroids are often prescribed for serious health issues, and stopping them abruptly can be dangerous. Your doctor will need to weigh the necessity of the corticosteroid therapy for your primary condition against the side effect of sexual dysfunction. They might be able to explore alternative treatments for your condition that don't involve corticosteroids if available and appropriate. They might also be able to adjust the dose or frequency of the corticosteroid to the minimum effective amount. In some cases, if low testosterone is suspected, they might test your hormone levels and discuss testosterone replacement therapy, though this comes with its own set of considerations and risks. Open communication with your doctor is paramount to finding the best management plan for your overall health, taking into account all aspects of your well-being. So, we've talked about medications for high blood pressure, high cholesterol, depression and anxiety, enlarged prostate, and long-term steroid use, 5 very common types of prescriptions. It's clear that while these medications are often essential for managing serious health conditions and improving longevity, they can, for some men, unfortunately, impact erectile function as a side effect. It's a complex interplay between the medication, your body's individual response, and your overall health. You might be feeling a bit overwhelmed or perhaps even concerned, thinking about the medications you currently take. But please, don't let this information cause you anxiety, or worse, make you consider stopping any of your prescribed medications on your own. That would be far more detrimental to your health than dealing with erectile issues. The real power here, the surprising element I mentioned earlier, isn't in identifying specific medications to avoid, but in the knowledge itself, and more importantly, in using that knowledge to have a truly productive conversation with your healthcare provider. Your doctor is your partner in health. They know your entire medical picture, all your conditions, all your medications, your lifestyle, and your personal priorities. They are the only ones equipped to help you navigate potential side effects like erectile dysfunction. Knowing that certain medications can cause this issue empowers you to bring it up confidently. You can go to your doctor and say, "Doctor, I'm taking X medication for Y condition, and I've noticed some difficulty with erections. Could my medication be playing a role? And are there any adjustments or alternatives we could consider?" This opens the door for them to review everything. Perhaps your blood pressure medication is indeed the likely culprit, and they can switch you to a different class, known to have fewer sexual side effects. Maybe your cholesterol is well controlled, and a slight dosage adjustment might be possible without compromising your cardiovascular health, while also improving erectile function. Or if you're on an antidepressant, they might suggest switching to one with a different side effect profile, or adding a medication specifically for ED. For prostate medications, they can discuss alternative treatments or ways to manage symptoms with less impact on sexual health. With steroids, they might explore if the dose can be lowered, or if there are non-steroid options. It's also crucial to remember that erectile dysfunction is often caused by a combination of factors, not just one medication. Underlying health conditions like diabetes, heart disease, obesity, and low testosterone are major contributors. Lifestyle factors like smoking, excessive alcohol use, lack of exercise, and stress also play a huge role. Sometimes, addressing these other factors can significantly improve erectile function, even if you stay on your current medications. Your doctor will likely want to explore all these possibilities with you. They might recommend lifestyle changes, suggest screening for conditions like diabetes or low testosterone, or refer you to a specialist like a urologist if needed. The surprising part is how simple the solution can be. It starts with just talking about it. Many men feel embarrassed to bring up erectile issues, even with their doctor. but your doctor discusses these things with patients every single day. It's a common health concern, and there are almost always potential strategies or solutions to explore. Don't suffer in silence or make assumptions. Your quality of life, including your sexual health, is important, and it's a valid topic to discuss with your healthcare provider. Remember, managing your core health conditions like high blood pressure, high cholesterol, or depression is paramount. The goal isn't to stop essential medications, but to work with your doctor to find the best possible balance for your overall health and well-being, which absolutely includes your sexual function. Small adjustments to medication, switching to an alternative within the same class, or addressing other lifestyle factors or underlying conditions can make a significant difference. Please, if any of this resonates with you, make that appointment to talk to your doctor. Be open and honest about what you're experiencing. It's the most effective step you can take towards addressing this issue and finding a solution that works for you. We hope this information has been helpful and empowering. Understanding the potential links between common medications and erectile function is the first step in taking control and having informed conversations with your doctor. If you found this video useful, please give it a thumbs up to help others find this important information. And if you have any thoughts or experiences you'd like to share, please leave a comment below. Hearing from others can be incredibly helpful for this community. Don't forget to subscribe to our channel and hit the notification bell so you don't miss out on future videos aimed at helping you live your healthiest, happiest life at every age. Thank you for watching. Live your best life.